You know what they say, an ounce of prevention is worth a pound of cure. And if you go ahead and head to the dentist's office, get your x-rays and your biannual cleanings, well, it really does go a long way. This next Ask the Medical Expert segment has been sponsored by Troy Family Dental in Troy, Illinois, where they're taking you down the road and the journey of oral hygiene and breaking down periodontal disease.
Periodontal disease is the most common infection out there. It's estimated that up to 70% of the entire population has some form of it.
A lot of patients don't know they have periodontal disease in the beginning because there's not a lot of symptoms that they feel.
It's known as the silent killer of teeth, and most people don't know they have the disease until it's too late.
So the initial infection starts with what we call gingivitis. The gums become a little puffy, a little red. Sometimes patients say, you know, they bleed a little bit at home, but doesn't everybody's? No, normal healthy tissue doesn't. So what can happen is that if that infection stays there, it progresses, they've picked up some bad bacteria. The bacteria produce toxins. If we take a look, if we can peel back the gum tissue around teeth, normal healthy teeth, we see that the bone is nice and tall and healthy and the teeth are nice and strong. If we develop periodontal disease, what we notice is that very slowly that bone level recedes away from the teeth begin to get loose, and the patient notices that their teeth are drifting, becoming loose, and they're not sure why. They finally come in and they find out that they're going to lose a lot of their teeth and not all of their teeth, and they're devastated.
The team at Troy Family Dental is working hard to prevent, slow down, and treat the disease in a proactive manner.
We treat it a little different than other offices do. We take sample of the bacteria, we send it to a lab so that we can get test results to know exactly what bacteria we're dealing with and that's causing the disease. We use a microscope to help us with that as well, to let us know how aggressive that bacteria is.
That culture will tell us the exact bacteria that the patient has. It'll tell us the exact antibiotics to use, and that in conjunction with liquid medication that the hygienist will use and that the patient will use at home will clear up the infection, stop the damage, and if the patient continues to see the hygienist and uses those medications at home, then we'll make sure the infection never comes back again.
In addition to treating periodontal disease, this dental office even takes steps to detect hidden conditions inside of the mouth through x-rays.
There are a lot of things that can hide from us in our mouths, especially between the teeth and below the gum line. So x-rays help us see between the teeth for cavities that might be starting that we can't see on the outside, or even that initial loss of bone from gum infections, periodontal disease, that we don't know that's going on.
So x-rays are important for periodontal disease because it shows us bone loss. This image right here, what we're looking at is it's the bite, so it's showing us the top teeth and the bottom teeth, and we can see bone loss in here. So this shows us our jawbone, shows us how much bone we've lost around there because of the periodontal disease.
It's a team that's reactive and proactive when it comes to your oral health, as long as you join them in the fight for good oral hygiene.
So to prevent periodontal disease, you want to do meticulous home care, brushing and flossing at least twice a day, and you want to see your dentist at least twice a year.
So we want to catch things early. So if you're coming every 6 months, we can, like periodontal disease, we can catch it before it gets started. We can catch it at the very beginning stages. Sealants are great preventative for the chewing surface of your teeth. It helps just fill in those deep grooves that we have, keeps them protected from cavities.
The mouth is the portal to the entire body. So any bacteria, any infections that we have will actually circulate through a system, which can aggravate diabetes and high blood pressure and all kinds of other medical conditions that patients don't even realize that they have an infection going on in their mouth. So we can find those things, it's for total body health, and we can keep their teeth healthy and prevent infections and pain and loss of teeth.
Helping you create good habits with expert care from the team at Troy Family Dental. If you're interested in learning more about the cutting-edge technology used here at Troy Family Dental to handle and take care of periodontal disease, go ahead and pick up the phone and make your appointment today. You can also head online to their website at troyfamilydental.com, or you can just visit them in Troy, Illinois, 20 minutes from any bridge. I'm Chelsea Haynes for Studio STO. Let periodontal disease be the silent killer of your teeth. Pick up the phone and make an appointment today. They're located 20 minutes from any bridge in Troy, Illinois. It's Troy Family Dental, where their entire team will treat you just like you're a part of their family.